And we'll begin doing that right now. The Trident system comes with these prong pliers, of course, that fit right into the holes of the wedge. So it's easy to remove that. We'll remove the stabilizing ring. And a little trick for taking the matrix out, that you see the holes on the each side of the matrix. We teeter-totter this thing. We just grab that through the hole and then up and down, and you'll see how simple and easy that matrix comes out. Before she augments the curing from the buckle and the lingual, I like to take the 12 blade on a scalpel handle and begin removing the excess. Most of this is adhesive because the way that band adapts so well to the proximals. My assistant will go ahead now and cure, once again, 10 seconds from the buckle. And when it comes to measuring depth of cure, and we'll get close to the tooth but not right on, she'll do it in 2 5-second increments. In other words, she'll switch over because of sometimes the heat's produced in with these LED lights, these high-powered LED lights. So the 10 seconds will be done 5 seconds at a time from the buckle and lingual back and forth. And what I was about to say is that oftentimes when it's talking about depth of cure, the classical depth of cure is actually measured. Well, there's 2 ways of measuring depth of cure. One is what I discussed in the lecture, where you measure the hardness of the top and the bottom after curing column of composite, and we desire to have an 80%. That is to say, the bottom have a Vickers hardness of 80% of the top. The other method of measuring depth of cure, the ISO standard, is to cure only from the top or the occlusal a column of composite, scrape it away until you reach cured composite, scrape away from the bottom until you reach cured composite, and then you take that distance from top to where the bottom is hard, and it seems somewhat arbitrary to me, but arbitrarily divide that in half and call that the depth of cure. When researchers measure depth of cure, however, they're only curing from the occlusal surface, and as you can see, we have augmented that occlusal surface cure by curing the same amount of time from the proximal, meaning the buckle, and the lingual. So we're really feeling very good, at least I'm feeling very good about the depth of cure of sonic film material.